Chapter 12 of the Administrative Dental Assistant textbook talks about inventory management. And some of the learning objectives that we'll learn with this chapter is one, we'll talk about how to establish a successful inventory management system. We'll identify the types of supplies, products, and equipment that are commonly purchased for a dental practice. We'll talk about the selection and ordering process of supplies, products, and equipment. We'll explain the role of OSHA and describe the various selections or sections of an effective hazard communication program and discuss what information is important to an inventory manager. We'll explain the role of the inventory manager in the infection protection program. So ordering and managing supplies in a dental practice requires organization, communication, and the cooperation of the entire dental team. Because the financial health of the dental practice depends on controlling costs, it is necessary to establish and maintain an inventory management system, or an IMS, that is cost effective, efficient, and easy to manage. So some of the things that the IMS will do, or I'm sorry, in order to find an IMS that works for the office, you'll first need to research and select the type of IMS that fits the needs of the dental practice. And this includes inventorying current supplies. You want to discard or recycle obsolete and expired products that you find in the office. You want to create a database or a list of inventory items, and this will include the name of the product, the brand name if it's not generic, supplier, or the vendor that's associated with that product, and any contact information that you need in case you need to reorder that product. You also want to establish the maximum and minimum levels to create a baseline for reordering. And you want to export the database into the new IMS once you do find one. An effective IMS, automated or manual, will provide similar outcomes. After the dental practice researches and determines the type of system and the functions that will be used, the next step is to inventory the current supplies and then get rid of all the items that are obsolete or products that have expired. So some of the key functions of an inventory management system, once you find one, is it tracks inventory supply purchases and usage. It uses data communication technology to transfer information such as barcoding. It efficiently tracks items by usage and expiration date. It uses data communication to place orders, track shipments, and pay accounts. It can interface with practice management software to generate multiple reports, whether it be financial or operational. It can interface with vendor catalogs and point of sale options. It can provide information required by OSHA. It can store data on individual computers, network servers, or even web-based cloud hosting systems. A multi-service inventory management system or software system can do multiple things. It can do inventory management, it can do online purchasing, and it can create financial reports and analysis. So with an inventory management, it maintains a complete and current list of all the supplies and equipment, can scan items in and out, can track expiration dates, and it will even alert you when products should be reordered. With the online purchasing feature, it can maintain a shopping list. It orders products from multiple suppliers. It leverages comparison shopping and places the order directly with individual suppliers in some cases. Another thing that, like I said, it can do is it can create financial reports and analysis, which can categorize how much money is being spent, and it can set and track budgets. An IMS uses a system of data communications that is able to transfer data quickly across both small and long distances or large distances. One type of data communication is the barcode. In an IMS, Barcoding is used to simplify and automate the tracking of supplies and products by transferring the information from point A, which is the item, to point B, which is the IMS database. Another type of data communication technology is radio frequency identification, or the RFID. This technology uses radio waves to identify or track objects. So typically there's a small chip, which is an RF tag, that stores data and then can be scanned by a reader in any direction. The RF tag is reusable and the data can be refreshed. This technology is often used in a fully automated system that uses secure centralized location for supplies. Using a manual inventory management system so whenever you have a practice that does not have a computer or has a limited computer program, manual systems can be used, but a manual system can be effective, but in most cases, it's far more time consuming than a good software program. A simple card index system or Excel spreadsheet can be used to track the use of supplies and products. An index card is formatted to include the vital information needed to track and reorder the correct supplies and products. So these are some steps in determining when to order. So number one, you want to determine how much of the product is used and how quickly it is used. So this is the rate of use. When we talk about the rate of use, it's how much of the product is used and how quickly it's being used. The lead time determines how long it will take for the suppliers to arrive at the office once the order has been placed. The master list should be posted in a place that is convenient for members of the dental healthcare team to access. So this is just a list that you place in the back, maybe in the sterilization area where perhaps back floor or back office assistants can jot down when they use the last of the supplies so that the person who is in charge of reordering can refer back to this master list and they can go off this so that they know in case they didn't see that somebody else had used the last pair of gloves or the last box of gloves. It's a list that they can go by to make sure that all the things that are needed in the office can be ordered. So who is this person that does all of the ordering in the office? This is the person that is known as the inventory manager. When you select an inventory manager or when the office selects an inventory manager, some of these characteristics are going to be considered. And that is the person organized? Do they have time to carry out specific duties like inventory and reordering? Do they communicate well with others? Are they a team player? And most importantly, are they a good shopper? It is acceptable to have, although it is acceptable to have one person in charge of inventory management, he or she must be given direction, guidance, and cooperation from other members of the healthcare team. Each member of the team has a duty and responsibility to help maintain the office's inventory. Some of the duties of this inventory manager include someone who develops and maintains an accurate inventory system, seeking input from the rest of the dental healthcare team. They monitor the inventory. They maintain an accurate or current database of all the products that are going to be used. They process the orders. They receive the orders and verify invoices. And they organize and maintain storage areas as well as track back orders. So it is easy to turn over all of the responsibility for inventory management to one member of the dental healthcare team. But this method is not always a good strategy because all of the aspects necessary to maintain a well-organized and efficient system can be daunting for one person. Different team members likely will have a greater knowledge of products in their respective areas of expertise anyway. Chairside assistants will know more about supplies used in treatment and administrative assistants will know more about supplies used in the front desk. Some elements of a good inventory management system is that a qualified inventory manager is in charge. Supplies and products are identified quickly. Products are stored appropriately according to OSHA requirements. Supplies are located for easy access by all members of the dental healthcare team. Reorder points are clearly identified in a database or with labeled tags, cards, or tape. A protocol has been defined or has been clearly defined for notifying the inventory manager when a product or supply should be ordered. And a process is in place for identifying which products need to be ordered, have been ordered, or are on back order. Several points must be considered when an IMS protocol is developed. It may be the primary duty of one person to maintain the system, but cooperation from the entire dental healthcare team is required to develop the protocol. So some steps in developing an inventory management system protocol include identifying products and supplies that are needed, selecting the vendor or vendors to be contacted, developing ordering guidelines, establishing a receiving protocol. That just means when the shipments come in, what are the steps that need to happen in order to receive these shipments. Organize the storage area to make sure you have room for your new shipment, and check for OSHA compliance to make sure that these items are stored in the appropriate areas, or are they, if they require an area to be cool or dry, they may need to be stored in a refrigerator, or if they need to be in a dark room temperature place, and a cabinet would be better. So there are different types of supplies, products, and equipment, and they fall into different categories. The first categories is consumable supplies and products, and these are items that are used and must be reused and must be replenished, so they cannot be reused. These include X-ray films, anesthetics, disposable needles, and saliva ejectors. Non-consumable products are supplies and products that can be reused for a specific length of time before they must be replaced. These are things like instruments and hand pieces. Major equipment includes equipment that can be used for longer than 1 to 2 years. And this is big equipment items like dental chairs, radiology units, autoclaves, and other big major equipment like that. So when ordering supplies, products, and equipment, the first step in the ordering process is to decide which supplies and products will be used. Some supplies are generic and do not require research before their purchase. Other products, such as restorative materials, require that the dental healthcare team research them before the decision is made as to which ones they want to use. By attending trade shows and dental conventions, members of the dental healthcare team are able to speak with several different vendors. Networking is one of the most valuable sources of information. Information can be exchanged through study clubs, membership in professional organizations, and continuing education programs. Manufacturers and vendors of dental products send representatives into the field. These are sales reps. These sales reps introduce new products, and during their visit to the dental practice, they explain the intended usage, instruct the dental healthcare team, and answer questions about the products that they represent. The purchasing of major equipment is time-consuming and involves large sums of money. The cost of a dental chair, for example, ranges from anywhere between $5,000 to $20,000. So when new equipment is needed, several factors must be considered. And One of these factors has to do with budget limitations. So how much money does the office have to spend, or how much do they want to spend on this type of equipment? What minimal functions does the office need this certain equipment to have? And what equipment features do they need it to have? Vendor choice is also going to be a consideration. And this is it going to be a catalog? Or sometimes manufacturers don't sell directly to individual practices. Instead, equipment is purchased through something called a supply house. There are several different ways, or a combination of ways, that dental supplies and equipment can be purchased and serviced depending on the size and needs of the dental practice. Traditional full-service companies are well-established companies that combine the power of large volume purchasing, equipment sales and servicing, and personal sales representatives. These companies offer a one-stop shopping experience. Direct sales companies sell their products or their product line directly to the dental practice. The limitation of these companies is they only sell a specific product line. The advantage of using direct sales is that it keeps the price of the product down because there is not another seller that adds to their portion of the final price. Online distributors are companies that provide supplies, products, and limited equipment. And unlike the full service model, they do not typically provide equipment service, field representatives, or technical support. Group purchasing organization, or GPOs, are a business model that uses the power of large quantity purchasing and then passes the savings down to their members. Before placing an order for supplies and products, you must consider several factors. The following is a list of questions that should be answered before orders are placed. So, what is the shelf life of the product? The shelf life is the length of time that a product will continue to meet the manufacturer's specific or specifications for use. What are the storage requirements? The amount of available storage space is also a factor to consider when one is determining the quantity of a product to be ordered. Will technology change before the product is used? Because of rapid changes in research and technology, it is best not to order large quantities of products that are constantly being changed and updated. So these are things like cements, bonds, resins, composites. These type of things are always getting like a new model or a new updated model type of revision. And so it's with these, it's almost, not only that is that they have expiration dates that you have to worry about. But with these types of products, you only want to order what you need, because more than likely next year they're going to have a newer, more improved version of that product. Another question is, has the product been tried and tested in the office? Many products remain on the shelf because the dentist and staff did not research the product sufficiently. I can't tell you how many times a doctor has requested a certain product or a certain item, and usually it's because they heard of it through a buddy or a sales rep, and if I didn't do enough research, I would end up ordering that product, and it would end up being not what the dentist thought it was going to do, and it would sit on the shelf, and it's a waste of money. So that's why certain things need to be researched, and we have to make sure that it's something that the office can use. Also, will information provided in printed material change before a new order can be used up? When ordering stationery and other printed forms, make sure that no changes in the information printed will occur before a new order is placed. So these are things like business cards. Are you going to be keeping the doctor that long? Is it a trial doctor? Is it a trial hygienist? Before you order new stationery and business cards, you want to make sure that that no changes there will be made. Also, is there a return policy? So when trying new products, check with the dental representative to clarify your options if the product fails to live up to its claims, or if the dentist decides that it is not the patient's best interest to use the product. Also, is it economically advisable to invest in a large quantity order? Before expending money for a year's supply of something, check other options. Are there other vendors that are going to have sales on the order or on that specific product or supply that you need? So you want to do your research first. After you receive supplies and products, the next step is to verify your order. So these are some steps in accepting shipments. So 1, you want to sign for the shipment, check for the correct number of boxes or items shipped, inventory the contents of each box, and verify them with the shipping invoice that is usually attached inside the box. Check the invoice against your original order to make sure that you didn't miss something or that the vendor didn't forget to put it in the box. File the shipping invoice, which will be used to verify the billing statement. Record any back ordered supplies. So in case you are looking for a certain size of gloves that's not in your order, make sure that it's not back ordered before you try to reorder that product again. File any new OSHA safety data sheets that are needed. Enter the quantities of the new supplies into the IMS system and place the supplies in their appropriate storage areas. It is the responsibility of the employer to instruct each and every employee about all areas of safety. The Occupational Safety and Health Administration mandates that a protocol be established that alerts employees to health hazards and instructs them about the proper ways to perform their assigned duties safely. A written hazard communication program must be maintained by the employer. Annual training sessions should be held. Each employee must know the following. They must know which chemicals are hazardous, what risk is involved when working with specific chemicals, how to use the chemicals safely to minimize exposure, how to handle the chemicals safely after an accident, and where to find information about hazards. So this is a safety data sheet. So for employees to gain this knowledge, they must be given product information. This information is communicated in the form of a safety data sheet, or SDS. The SDS is made available to the employer by the manufacturer of the product and is usually sent with the product when it's delivered. SDSs should be maintained in a notebook or in an electronic format that can be easily accessed by all employees. All dental practices, regardless of size, location, or level of patient care, must follow very specific infection prevention and control protocols outlined by the Center for Diseases and Control Prevention, which is the CDC. In the CDC's guidelines for infection control in dental healthcare settings, there is an addition to the original guidelines. So the CDC has published information, summaries, and reports to help the dental healthcare team better understand the requirements for safe care in the dental setting. Some key administrative recommendations for dental settings include develop and maintain infection prevention and occupational health programs, provide supplies necessary for adherence to standard precautions, and this includes hand hygiene products, safer devices to reduce percutaneous injuries, and personal protective equipment. It'll assign at least one individual trained in infection prevention responsibility for coordinating the program. Another one is to develop and maintain written infection prevention policies and procedures appropriate for the service provided by the facility and based on evidence-based guidelines, regulations, or standards. And the facility has a system for early detection and management of potentially infectious persons at initial points of patient encounters. Some additional components include infection prevention, education and training, dental healthcare personnel safety, program evaluations, standard precautions like hand hygiene, PPE, respiratory or cough etiquette, sharp safety, safe infection practices, and dental unit water quality. All right, that's all I have for this chapter. Let me know if you have any questions. Thanks for listening.